Back with the WMAY Morning News Feed, I'm Greg Bishop, and let's talk now with Illinois Fraternal Order of Police President Chris Southwood to get his reaction to the looming changes of the Healthcare Right of Conscience Act. Those changes passing last night, late in the night, after it passed the House the night before, after being amended, after having tens of thousands of Illinoisans from all across the state, from all different sectors, parents, college students, fathers, mothers, police officers, frontline workers, nurses, corrections officers, all kinds of people filing witness slips in opposition to these changes to the Healthcare Right of Conscience Act. And somebody who raised the alarm on this pretty early on in this process is Chris Southwood. He's the president of the Illinois Fraternal Order of Police, and he joins us here on the WMAY Morning News Feed. I'm Greg Bishop. Chris, thanks for taking time with us this morning. Let's get your reaction here.
Thanks very much, Greg, for having me on again this morning. Reaction, completely disappointment, complete disappointment. Once again, in the middle of the night, while many Illinoisans slept, we had 95 General Assembly members, 95 legislators who ignored over 70-some thousand opposing witness slips, and they voted to amend the Healthcare Right of Conscience Act, taking away citizens' right to their personal conscientious freedom of choice when it comes to getting a vaccine that is unproven and doesn't always necessarily work.
And Chris, it wasn't just the vaccine. I mean, we've also got some opposition to the masking issues here. Are those the same types of concerns that you and your members have as well? Or not masking, but the testing, the option of, well, if you don't want to get the vaccine, then you can test weekly. Do your members have concerns about that as well?
Well, they do if it's implemented the way, like for instance, Mayor Lightfoot wanted to implement it on Chicago police officers, and that is, I don't think most first responders have necessarily a problem with the testing as long as it's done on company time and at company expense. But the mayor in Chicago, she wanted to force the testing on your own time and at your own expense. Now, the problem with that is if you test on positive for COVID on your own time, where does that leave you when it comes to, work and time off issues? And basically you're going to be kind of on your own, aren't you? So I think if you're going to mandate this as a term and condition of employment, if you allow the officers to be tested while they're working, on company time at the company's expense, that's a lot more easier to deal with than saying you have to take the test on your own time and at your own expense. Bottom line here is the mayor, the governor, they're forcing the vaccine on people. They are trying to force the vaccine on people and taking away that testing option by saying you have to do it on your own time and at your own expense.
Chris Southwood, he's the president of the Illinois Fraternal Order of Police, joining us on the WMAY Morning News Feed. And Chris, what are the things you're hearing from your members? We've seen Indiana trying to recruit police officers from places that have vaccine mandates. Florida apparently looking at the idea of offering up a $5,000 bonus for new police officers. Alaska, I saw, is going to try to do something as well. Are your officers content with just, I guess, hey, this passed the legislature? Are they content with just dealing with that? Or do you have people that are looking for greener pastures elsewhere?
Oh, we have a lot of people looking for greener pastures elsewhere. But for me personally, I hope that's not the solution. We don't want to lose trained, qualified, good police officers to other states just because other states are offering a freedom of choice and not forcing their officers to do that. I mean, I hate to see us lose good qualified police officers. We're having trouble recruiting police officers all across the state. We're having trouble retaining police officers all across the state. I don't blame the officers for making that choice, and there are many who are making that choice to go ahead and leave. But frankly, there are many citizens in Illinois making the choice to go ahead and leave Illinois. They've had enough of the one-party rule, one-party system rule. That's unfortunately our government here in Illinois. And I certainly hope that a lot of officers, I understand if they take advantage of it, but I certainly hope they don't, because, that's a shame to the citizens of the state of Illinois that we're losing so many qualified and experienced police officers to other states.
those of us who do stick around in the state of Illinois, what do you hope happens between now and when this gets implemented, July 1st of 2022, and even heading into the November election?
Well, clearly, I hope this is a wake up call. We have a critical election coming up in November of 2022. It'll be somewhat of a historical election in that every seat is open. All the governor's seat, all general assembly seats are open. And I certainly hope this is a wake up call to the citizens of Illinois. Look, this one party system of rule that we have here in Illinois, it isn't just destroying law enforcement. It isn't just making our communities unsafer. It's literally destroying Illinois. And we, the people, have to stand up and we have to make some changes. And we have to hold those 95 legislators who chose to take away personal freedom from our citizens here in Illinois. We have to hold them accountable come next November. The Illinois FOP said we were going to do that. And we are going to work hard to make sure we hold those General Assembly members accountable for the vote that they took.
Chris Southwood, president of the Illinois Fraternal Order of Police. Appreciate your time. We'll definitely talk about this issue and other issues in the future. Be safe out there, all right?
I look forward to it, Greg. Thanks for having me on.
Yep. It's the WMAY morning news feed. And coming up, we'll talk with a breast cancer